Hello and welcome to Health Reform Watch, a collaboration between Reuters and the Forum at the Harvard School of Public Health. My name is David Morgan, healthcare policy correspondent for Reuters in Washington, and I'm here today with Professor Robert Blendon of the Harvard School of Public Health. Professor Blendon is a leading expert on healthcare policy, politics, and public opinion, and we'll be talking to him today about the Affordable Care Act and its role in the 2014 congressional elections. Greetings, Professor. Welcome to Health Reform Watch.
David, glad to join you today.
Recently, we've had some indications that Republicans may be taking another look at Obamacare as a campaign issue. 2 Senate confirmation hearings for Sylvia Matthews Burwell were supposed to provide a platform for new Republican attacks on Obamacare, but instead they turned out to be very cordial. House Republicans have been returning to their districts and telling voters not to expect a repeal of Obamacare, even if the Republicans win the Senate. And of course, negative news about the law has been somewhat muted lately because of successes with enrollment and the fact that healthcare premiums in the Obamacare marketplaces have not spiraled out of control. Now, obviously, appearances can be deceiving, so let me ask you this. What's actually going on out there?
David, a dilemma for those of us who study politics is that we tend to see storms that many people don't see early on. So let me see if I can put this in some context. The month after the administration announces that there are 8 million people now enrolled and the website's working, there are 9 polls that are done nationally. If you average the 9, in all of them, the majority of people still do not support this bill. Secondly, if you look at people who favor the bill across the 9 surveys that were done, it's 2% higher than April 2010. So if you're in politics, you look at that and say, this hasn't taken off the way you would expect if you were sitting in Washington at the moment. And also, as a comparison point, 4 years into the enactment of Medicare, it was unbelievably popular, and no member of either party was running on repealing or replacing it. It would have been absurd to do that. But yet that's what we see coming into the 2014 election. So I just need to take a second to explain to you and viewers how this could happen. Why doesn't it change? Why don't people leap up? And it turns out when you look very carefully, middle-income Americans who had health insurance remain scared of this bill. They think that things are going to happen to their premiums, to the restrictions in medicine practice. Their employers may change coverage or drop it. Their taxes may go up. Middle-income workers are worried themselves. You add to that the fact that people near or at retirement are worried that they don't have enough money to retire on, and they are afraid that this bill is taking money from their Medicare and putting it to make this bill financially work. So what happens is when they listen to the story about 6 or 7 or 8 million, they're not paying enough attention because they're worried about what's happening to them, not about the newly uninsured, and that's why the numbers don't work. And so let me, before we just sort of get a next question, let me talk to you about the upcoming election. So an off-year election in these races that are going on, it turns out there are 12 states that are going to have competitive Senate races. And they're not the states that a lot of people focus a lot of media or discussion on. They're Colorado, they're Montana, they're Kentucky, they're North Carolina, they're Louisiana. And we know 2 things about these 12 states. We know that the bill remains, after the 8 million, more unpopular in those 12 states than in the rest of the country. Secondly, it turns out that these 12 states have enrolled a lot less people than other states have nationally. And I don't know about you, but when I hear 8 million, I assume in every city and town and hamlet in America, thousands are now enrolled in this plan. But it turns out there are a few states like California and a few others that have enrolled a large share of the people enrolled. And these 12 states where the races will be very, very close haven't been it. So when you think about moving into this election cycle, you find that the critical competitive states are not that enthusiastic about this bill.
Opposition to Obamacare does appear to be high. That is Obamacare, quote unquote. But even in some of these 12 states, it seems that when you delve into the polling material, many people, in some cases most people, don't want to see the law repealed. They want to see it fixed. Now, given that, and the fact that the Tea Party primary election threat this year has not turned out to be as lethal as it has been in the past, are Republicans potentially in a position to reconsider their message on Obamacare before the start of the summer campaign season?
There are two stages here. In primaries, in some of the primaries, Republicans running are going to be concerned that if they move too far from repeal and replace, that they still could face a challenger from the even far right. When it comes to the general election, Republicans are going to have to rethink their position. And my view about what voters want in these states is slightly different than others. They really don't want a complete repeal. There are very popular things in this bill, but there are a number of things that they want really scaled back. An example is the mandate on individuals to buy insurance is incredibly unpopular. And we have 30 million people who didn't get coverage who are going to be in some form or other possibly subject to the mandate. This turns out to be very unpopular in many conservative states. And so there are regulations on insurance, your choice, plans not being available, and people want these scaled back. So what's important is that Republicans could be stuck. If all they have to say is that I'm going to repeal a bill, they're going to have a problem. If they come out with a set of principles that lay out where they want to go over the next few years, that basically substitute things for what's in the current bill, but keep part of the structure, they're likely to be where many conservative voters are. I, for one, do not think this bill will play in 2016 with any way the salience it does now. These issues don't go on for decades here. And also 2016 has state Senate races that are much more democratically oriented. The turnout of voters, younger people, minority communities likely to be very high in that race. People who are likely to be very supportive of aspects of the bill. So I think if you and I were talking about 2016, this whole discussion would be different. Whatever bill is there would look like it was very likely to stay. Republicans would try to make some changes, but the wind would be on the side of the Democrats and the president with a bill. But 2014, the wind is actually the other way around, and I think Republicans can't afford to think too far beyond this election, because if they are in the majority, they have a chance to shape the agenda, as people who watched what happened with Bill Clinton and a Republican Senate and House in 1995 found out. They became the leaders of where the agenda was going. But if the Senate remains, then the agenda will be very different. So I think the next morning after the election, everybody's going to wake up, take a cold shower, and say, where are we on this issue? If I can, David, I'd like to add something, because there was an important study that came out this week. And if you don't follow these things very closely, you miss how it is. And it's a study that by the Cantor Media Group, which studied the purchase of private ads after the Affordable Care Act was passed. And what they discovered was, and it's staggering, that $445 million of ads were purchased about the ACA after it was enacted. This is sort of unheard of. And by 15-1, the money went to anti-ACA ads. Many of them focused on the states that are now in contention, and many of them focused on themes about not how to cover the uninsured, but how middle-income people and near retirees would be worse off. I don't know if that kind of money is going to be available again for the fall campaign. But if it is, it's going to alter some of the turnout and some of the responses to polls if all people see in some of these states is 15-to-1 negative ads versus positive ads. And that, again, shows the uniqueness of this debate. We've never seen this scale of advertising after a law is passed. It's usually over. You move on. And this is what has made this issue so difficult to predict, is the type of continuing political struggles that go on once the act is in place.
Unfortunately, Professor, we're out of time, but thank you so much for offering your insights on these fascinating topics. And thanks also to our viewers for tuning in to this edition of Health Reform Watch. I'm David Morgan. See you next time.